Right, so we've been dispatched to a 30-year-old female today. It looks like it's an imminent birth. She's known to be pregnant and she says she's experiencing labour pains. So we're driving there, it's an urban area, seems to be safe, nice quiet neighbourhood. Arriving at the house, single story, easy access, egress. Seems to be safe, there's no pets, no rowdy family, nothing like that around. You comfortable to enter? Cool. So we'll enter in. Right, hello, I'm Dana from the ambulance. This is Daniel. What's your name?
Maxine.
Maxine. Hello, Maxine. What seems to be the event that's occurring today, the reason that you brought us?
I think I'm about to give birth.
Right, okay. Do you think you've gone into labour?
I think so.
We've got some extra linens here which I'm going to lay out. I'm going to start with a bluey for my baby not to come down yet. How far along are you?
38 weeks.
Right, do you know your due date?
In a few days.
Okay. Right. Do you have a LMC?
Yes, I do. She's on her way.
Okay. Do you know when she's going to be here?
She's not sure. She's stuck in traffic at the moment.
Let's take blood pressure now.
Have you had any complications with your birth?
No, it's all been there pretty clean.
Okay, yep. And you've had all your ultrasounds, etc., etc.
He
Right.
was in a good position.
Brilliant. Right. Are you experiencing contractions at the moment?
Yes, I am.
Yeah. Would you like some pain relief for that?
No, I don't. I want to do it all natural.
Okay, that's fine. Do you know how far apart and how long your contractions have been?
They've been about a minute apart.
Okay, so it does look like we're going to have the baby here. Do you mind if I have a look?
Of course.
Okay, so there's no crowning yet. Right, if you feel the need to push, you just let me know, okay? Yeah. In a scenario, I would have my resus kit set up, ready to go, both for the baby and the mum, just in case. I would have it covered with a sheet, but ready to go.
I think it's coming.
Do you think it's coming? Alright, I'm just going to have a look, okay? Yeah, I can see it starting to crown. What were those obs you got?
So 80 for the pulse, 150 over 100, and 22 for the reps.
Keep going. Awesome, that's fine. You got it? You got it? Yep, there you go. Almost there. Okay, so I'm supporting the head. Yep, the head's out now. Nice. One more push. Nice. Supporting the baby the whole time. Okay, so baby's come out. Baby looks great. I'm going to stimulate him with a towel and dry him up, making sure I'm cleaning his face. He's crying nicely, nice and loud. Definitely a score of 2. So his airway is clean and clear. Apart from that, I'm going to keep him warm. He's a little bit blue in the peripheries, so that gives him a total lap gas score of 9. So, could you get a pulse rate for me,
Yep.
please?
It's
Nice.
definitely over 100.
Yeah, that's definitely over 100. I'm going to just change the towel. Nice clean towel for baby. Give him back to mum for some nice skin-to-skin contact. Let him breastfeed if he wants. That'll help stimulate oxytocin and get the placenta delivering.
Okay.
I would expect the placenta to deliver in about the next 30 or so minutes. I'm going to keep an eye on the cord, seeing if it stops pulsating at any, and when it stops pulsating, I'll cut it. Could you do another set of obs on the
Yep,
mum?
sure thing.
Also, always monitoring the baby, making sure that it's still fine. I've noticed that the cord has stopped pulsing, so I'm just going to cut the cord. Is there anyone around, or would you like to cut the cord?
No, husband's on the way though. But
Okay.
he's not fast.
Okay. Oh, so you want to clamp 10 centimeters away from the baby, and then another 5 centimeters away from that. And you want to cut in between those clamps. Cool. Open that back up again. What were those obs?
So no change in the blood pressure.
Yep.
No the pulse. It's the end.
Cool. Right, let me know when you feel the need to push again, because it'll probably be
I
the
think I need to push again
Okay,
now.
cool. So that's probably going to be the placenta.
Cool.
I've got a biohazard bag.
Pulse of 86.
Brilliant. Perfect. Just gonna have a quick look. Seems intact. Yep. Gonna put this in a biohazard bag. Gonna take it to hospital. making sure that it's intact so that if any pieces are left that in the mum, that can cause infection or maybe a postpartum hemorrhage. That's also something I'm looking out for, is if any excess bleeding. Some bleeding is normal, but don't want to get
I
there
think
too
my
much.
husband does want to eat that. He's
Oh,
not ready.
that's fine. Midwife is on the way. Would you like us to take you to hospital or would you like to wait for her?
I'd rather stay at home.
Yep, that's fine. Are you feeling comfortable at the moment?
Yeah.
Yep, cool. After the delivery of the baby, we will expect the placenta to deliver on its own. As a paramedic, we never want to put traction onto the cord, as this may break it, causing monumental issues for the mother. And after the delivery of the placenta, you want to find the area of where the uterus is estimated to be, so about around the belly button, massage it in circular motions until it feels firm. Something to consider if the mum did want to transport with us. I would have gotten my offsider to warm up the ambulance, as we don't want the baby to become hypothermic, which is also where we put a beanie on and keep it wrapped up in skin to skin with mum. It's not needed to travel under lights. If the mother did want to seek hospital support and not want to wait for her LMC, I would have gotten my offsider to either bring the stretcher in or a stair chair, or get the mum to walk to the ambulance depending on what she felt up to after her birth. There'd be no rush. I would also consider the mum showering if that's what she wanted to do, just to clean herself up. A postpartum hemorrhage is classed as continuous bleeding after the delivery of a baby. It's considered a PPH if it's over 500 mils of blood that have been estimated to be lost. And in this event, oxytocin would be administered via backup at an EMT level. When gauging the condition of a newborn baby, you can use the APGAR acronym. It stands for Appearance, Pulse, Grimace, Activity, and respiration. In my case, my baby was a little bit cyanosed and they were a little bit blue around the peripheries. This is normal for a baby to stay like this up to several hours after their birth. The normal ranges for a very healthy newborn baby would be about 7 to 10. A sick baby would have a score of below 4 to 6. Each of those categories can count for up to 2 points. So for each category you can get no points or a full set of 2. So in my case, initially, at my baby's initial presentation, it had a score of 2 for all of those categories, apart from its appearance. It was a little bit blue in its extremities, which is normal. If it was in our scope as a paramedic or an ICP, we would have considered delivering oxytocin as an IM injection. It can help prevent a postpartum hemorrhage and help speed up the placenta delivery. Its only contradiction is a known severe allergy, and it's got no cautions. If my patient had requested a form of analgesia, I would have chosen methoxyflurane to use. It's an inhaled pain relief that's indicated for moderate to severe pain, which clearly is indicated for labour as well. The contraindications are if the person has had it in the last week, has a known severe allergy, has a history of malignant hypothermia, has renal impairment, is not able to obey commands. It's cautioned for preeclampsia, and you don't want to administer it within a confined space or in someone over 75 years. That's when it's cautioned because it may worsen. The safety of methoxy hasn't been demonstrated, but they've been using it in Australia for many years and it's been safe. We can administer it to patients as long as we inform them about the potential risks, or that we cannot guarantee its safety of use during labour or breastfeeding. The CPG says that we can give it, but breastfeeding must be stopped until the LMC is contacted. The dose of methoxy is, for an adult, is 3 to 6 mils. They can go up to 6 mils if they require that amount of analgesia, and it comes in 3 ml ampules. It's got quite a rapid onset of about 1 to 2 minutes, and the patient may dislike the taste, have a headache, feel nauseous or dizzy, and it also might have a slight sedative effect.
Unintentional.
There you go. attaching this again.
There'd be no rush. I would also consider the mum showering if that's what she wanted to do, just to clean herself up. Yeah, cup of tea never hurt no one.